Frailty is becoming more and more important. Why? Because newer drugs are they are more effective, but they also have their own toxicity profiles. And when elderly patients present with a more frail condition, we need to adapt our treatment strategy. And instead of going to a single drug, which is less effective, we may start with less intensive approaches, as much as drugs as possible, to have an efficacy so that the disease-related frailty issues may decrease in time to allow the patients to have more drugs to be given to give them again an increase in the response rate. So this is a very dynamic approach, and we need to measure frailty. There are multiple scores in the field, but the IMWG frailty assessment seems to be the most welcome one. And it's sometimes it's very practical, based on the patient's independence from the family to be able to perform on own, financial issues, physically. These are very basic things that can have an impact on the treatment decision and also the success rate of the treatment. So we have to decide to give the most intensive regimen that the patient can tolerate versus to a more frail patient who cannot afford. And so despite the efficacy of that regimen in another population will be inferior in such a population. So it's everything is based on your judgment at diagnosis, but it has to be dynamic. We have to measure it with each step so that we can allow to escalate treatment to be able to reach the level of patients who are more fit in the beginning.